We know February is an important month. It's both Black History Month and Heart Health Month. Cardiovascular disease happens to be the highest among African Americans, and the heart failure hospitalization rate for Black patients is more than twice that of white patients. So Allina Health has put together a plan to reduce healthcare inequities when it comes to cardiovascular care. So joining us now is Dr. Mosi Bennett with Allina Health. Dr. Bennett, thanks for joining us.
Good morning. Thank you so much for having me.
Let's jump right in here. Tell us more about the efforts that Allina has made to address really the bias in racism when it comes to healthcare.
Well, as you know, there are disparities in healthcare and disparities in cardiovascular care. African Americans are more likely to die from heart disease and more likely to be diagnosed with heart disease. They develop it at an early age, and they're more likely to be hospitalized with heart disease. This includes heart failure. A lot of that is due to the increased prevalence of risk factors for heart disease, hypertension, diabetes, and obesity among African Americans. But a lot of it also has to do with some of the social factors: access to good care, access to good food, living in a safe neighborhood. One thing that we've done at Allina, MHI, Minneapolis Heart Institute, is formed a community clinic partnership to work with our community clinics to improve access to care and improve awareness about heart health.
What does that action plan actually look like? Because it sounds great, but what steps are being taken? What does that look like?
Yeah, so there are really three main steps, three main things that we've been focusing on. The first is building relationships. We have a cardiology curbside phone access line where community clinicians can call in and speak to a cardiologist. We've worked to improve access to this phone line for our community clinicians. So it's really easy to talk to a cardiologist. And we've seen a significant increase in the number of calls and the building of relationships. Also, we provided education. Cardiologists are now going to community clinics and providing education about high blood pressure, exercise, the importance of preventive health. And again, that's part of building relationships and providing education. The third thing that we've done is that we've educated ourselves. So we've had a speaker series about anti-racism, bias in medicine. We brought in nationally recognized speakers to really teach the physicians at MHI about some of the inequities and bias in medicine.
I'm curious to know how much this plays a role too. Fear. We know the history, and we know that sometimes people are afraid to go to the doctor or steered to go away from the doctor. How much does that play a role in this too?
Well, there is definitely plays a role in the sense of the stress associated with concerns about one's health, the kind of putting off or delaying getting some of the preventive care that really has been shown to be very important in the prevention of developing heart disease. So that definitely is an aspect. I think building the connections and building the relationships with our community has really helped break down some of those barriers.
What would you say would be, what would it take for you to say, we've made it. We've really made a connection with the community and we're starting to see more. What would that take in your opinion?
Well, it'll take efforts like what we're doing at MHI, but there's so much more to be done. And I think that when we can finally say that there's no disparities, racial and ethnic disparities in healthcare, and there's really health equity, we know that we've done our job, but we have a lot of work to do.
I'm so glad that you brought up the thing, and one aspect is access to quality food. You talk about food deserts, and a lot of times, an area may have a grocery store. For example, in North Minneapolis, they had the Aldi grocery store that has just moved out. So now people are saying, well, where am I going to get quality food? So that's a really important topic that needs to be touched on too. It takes more than just one effort. This is a multi-approach effort that has to be taken, that has to be put forth, right?
You're absolutely right. I mean, you're great point about the food deserts. Some neighborhoods you have your choice of 3 supermarkets to walk to. Other neighborhoods you have to drive several miles to get to a place where you can get healthy food options. And it's going to take an effort working on these social factors as well as some of the preventive measures.
Dr. Bennett, real quick, because we're running out of time, where can people go for more information when it comes to cardiovascular health?
Well, you can visit the Allina website, Minneapolis Heart Institute website. You can also talk to your primary care doctor and also the American Heart Association website.
Dr. Bennett, thanks for joining us. We appreciate your time.
Thanks so much for having me.